The question states, do you know if there is a particular immunotherapy that can cross the blood-brain barrier? So I expect, the question is around if somebody has metastatic melanoma to the brain, is there any particular immunotherapy that is recommended and it can cross the blood-brain barrier? Well, first I'll address the immunotherapy and whether the immune checkpoint inhibitors can cross the blood-brain barrier or not. There has been actually a recent study in the field of glioblastoma, and they measured the concentration of pembrolizumab, or the drug called Keytruda, in the cerebrospinal fluid, which is the fluid around the brain and around the spinal cord. And they found that the concentration of this medication is 1% of the concentration in the blood. And we know that those monoclonal antibodies are large molecules, so they may have hard time getting into the blood-brain barrier. However, if we look at the clinical trials of metastatic melanoma to the brain, and we have two important trials that I will put the link to them here in the description of this clinical trial, the Checkmate 204, people with metastatic melanoma to the brain. There are two cohorts in the study. Cohort A, people with no symptoms. They received ipilimumab 3 mg per kilogram and nivolumab 1 mg per kilogram every 3 weeks for 4 cycles, followed by single agent maintenance nivolumab. The cohort B, these are people who had symptoms and they could be on a low dose of dexamethasone. So the group A, or cohort A, the 3-year overall survival was approximately 72%. It was 71.9% to be the exact. And the overall survival for people in cohort B was 36.6%. To use, is it one drug is effective or two drugs effective? We can look at the Australian study. It's called the ABC study, and in that study they have 3 cohorts, A, B, and C. The cohort A, people with no symptoms, they got ipilimumab and nivolumab, and people in cohort B, they have no symptoms, but they got only nivolumab, which is similar to Keytruda. And cohort C, people are really, really symptomatic. They could have leptomeningeal disease, and they got only nivolumab. And the results, we got a 5-year overall survival for cohort A, which is people who got ipilimumab and nivolumab, is 51%. Cohort B is 34%, and cohort C is 13%. So as you can see here from both trials, the Checkmate 204 and the ABC clinical trial that was done in Australia, it seems that the ipilimumab and nivolumab is the way to go when somebody is diagnosed with metastatic melanoma to the brain. So that's what we do in our clinic, and we offer ipilimumab 3 mg per kilogram, nivolumab 1 mg per kilogram, IV infusion every 3 weeks for 4 cycles, and then we continue on maintenance nivolumab after that. Again, I can't stress enough the importance of the multidisciplinary team, consulting radiation oncology, consulting neuro-oncology, these cases are discussed in a multidisciplinary fashion. When to interfere with radiation? Do we need to interfere with radiation? Do we need to give stereotactic radiation now, or just wait and monitor every kind of month to 6 weeks and just see, if immunotherapy will do the job? What's nice about the checkpoint inhibitors is once they make it to the blood, they activate the T cells, and when the T cells are activated, the T cells or immune cells, your immune cells, can go ahead and cross the blood-brain barrier and reach the tumor and starting, attacking the melanoma in the brain. So even if the concentration of the immunotherapy in the brain is low, and that has been seen, as I said to you, in a recent study done in people with glioblastoma, where they given pembrolizumab, they found that the percentage of pembrolizumab in the cerebrospinal fluid was only 1%. That compared to the percentage in the blood, 1% only.
it's very low. But again, the efficacy of immunotherapy is not by it crossing the blood-brain barrier. The efficacy of it by stimulating the immune cells, and the immune cells will go to the brain and hopefully attack the melanoma. And we have seen that in the clinical trials. I mean, all these clinical trials proven the efficacy of immunotherapy, and mainly we use 2 drugs, and these responses, when they happen, they are durable.